Thank you.
Good morning, everyone, and welcome to this conference on health cooperation in the Barents region after COVID-19. The conference today is divided in two parts. We will have this first session now until 12 o'clock and the second one in the afternoon with a political representation. My name is Jörgen Gyllenblad from the Ministry of Health and Social Affairs in Sweden, currently chairing the Joint Working Group for Health and Social Issues together with the Russian Republic of Karelia. I'm looking forward to all presentations today on this very important topic on our future health cooperation in the Barents. Our sparsely populated region faces specific challenges in providing a high quality and comprehensive healthcare services. The current pandemic has shown that health is the foundation of functioning and wealthy societies, but also how vulnerable and interlinked our societies are.
Well, first of all, good morning also for my behalf from this grayish Helsinki morning. It's very autumn-like in here, but I think also the beautiful autumn colors are with us, so giving us some kind of comfort for coming long winter that is ahead of us. I think I should start, and I would like to start first by congratulating for the Norway and Norway chairmanship in the Barents Cooperation for the remarkable work what they have done in the nearly 2 years time that the presidency has been going on, and the chairmanship, which actually probably has been different than any of us has even been able to imagine. I think this is the first ever COVID presidency that we have felt in the Barents Cooperation, and the presidency where you have been forced to change and alter all of your working manners and structures that you have done. And I have to say that I think the Norway deserves enormous credit and congratulations on how well it has been able to adapt to the circumstances, will be able to change and make genuine digital leap to the future for all of us and the interest of all of us. And in fact, also in this very demanding and challenging time, Norway has been able to maintain the commitment from all of us for this cooperation, and I think this is something that truly deserves congratulations and deserves the gratitude that we can express to that. And looking forward very much for the concluding meetings in Tromsø in roughly in 1 month's time, when the presidency conclusions will be drawn in there. Also, I don't know what kind of crystal ball the Norway had when they were choosing the presidency priorities for 2019 already, by having health as one of those key topics for this chairmanship that they had and they have, because I think what this COVID has been proven, the questions of health and questions of cooperation in the health has become to all of our agenda in a manner that nobody has been able to imagine. I think it is important to address, especially also now on the Barents context. But if you look, we're talking about now the different kind of cooperation in the health issues globally, whether we talk in the UN context, whether we talk inside the European Union. Those who heard, for example, the Commission President's speech, State of the Union speech, the initiatives and ideas of creating a complete new kind of structures for securing the coordination and coherence of our common policies on the agenda there. And therefore, maybe one of my main points that I would like to address and raise specifically to you is really the question concerning that we need much more structured cooperation also in the Barents area for securing the coordination and securing the flow of information and our preparedness that we need to have for preparing for this kind of similar kind of challenges that might be coming to our lives also in the future. And I think if you draw at least some specific lessons, or maybe some lessons that you can draw already from experience we can have from the past two years' time. We need to have a better dialogue. We need to have a better coordinations, and we need to have this coordination from all level, from the regional level to the national level too. My family was born and raised in the Torniodalen, in the border between Finland and Sweden, and crossing the border has been self-evident fact that since I was child and since I was born. Half of my families live in the Swedish side and another half in the Finnish side. And the fact, as my 80 years old mother says, that for the first time since 1944, since the Second World War, she has not been able to cross the border, has been a profound effect in her life that she will remember for the rest of her life, that how could it be happen that what we have built for years and decades together, keeping the border open, keeping the borders peaceful, and having this kind of unique cooperation throughout the Barents, that where we can cross the borders and where we can meet each other, suddenly is broken by this kind of pandemic. And of course the decisions that we've been forced to make and how the government has felt that they have been forced to make. So I think generally we need to secure that whatever challenges, what kind of pandemics there might be in the future, that we have to do utmost to secure that this border will be open, the people have a chance to cross and have a chance to work, live, visit, and continue the traditional way of living what they had. And whatever decision we make should be coordinated as much together as possible, and having a common approach in the issues. And I think the structures that we have in the Barents cooperation, the working group, the working groups, I would even say, what we have should give us adequate resources and adequate formulation for this kind of decisions. And I think we should address specifically that using the authorities and using the structures that we have would be extremely important in preparing for whatever future challenges we might be having and coming in the foreseen future that we can't even anticipate. The second thing what I would like to draw a conclusion maybe is that I think the fact is what we have to prepare, that the COVID-19 is to stay with us. There's a new and new variations and new mutations, and somehow we have to learn to live with it. We have to learn to live with that it will be among us one way or another. We have to learn to live with the vaccinations, another source of new reality, or the new reality which we have. I have a 4 years old son who's constantly washing his hand, who's constantly looking for the hand gels and etc. etc. Something also has changed. I think for the permanent basis in our lives, that we have to be prepared for the different kind of living and different kind of even working structures. And this is the second thing also, that I think the work life that we had before will be different than it is in the future. What the traditional way of working, what we had done, will not be the similarities in the future, and we also have to be able to adapt ourselves for this kind of new realities that we'll be facing in there. When it comes to the Finnish Barents presidency starting in roughly 1 month's time, we will definitely continue the path that has been laid by the Norway and also the previous presidencies before the Norway. And it is with a great satisfaction that we have felt, and I believe we all share with the fact that there's a strong consensus among all the players in the Barents of the primary priorities that what we have. Focus on the climate environment, focus on the people, focus on the youth, focus on the knowledge and education, and focus also on the infrastructure, etc. So we're very proud with the fact that we are trying to carry on the Norwegian heritage, on especially concerning the cooperation in the health and also in the medicine sector. And I can also tell you already that one of the priorities that we specifically trying to look for it, and we also reserving some resources for that, is focusing on the telemedicine. Because I think one specific feature that has been also been self-evident for us in the Barents is this situation of sparsely populated people, and also the vast distances that we have in, and remoteness that we have in. And telemedicine can actually be one of the tools that we should be exploring even further and even more in the future, especially also when it comes even in question about the mental health of the people, which I think is also one of the challenges. What the COVID has shown to us, that the remoteness together with the situation where there's no possibilities to move and travel is something which has been in burden to many people, specifically to the young people who have completely different aspiration of their lives, and they've been forced to stay in one place, and they have not having a chance of free movement that has been a self-evident fact before. Also, I would like to mention very briefly which I started concerning the climate. I think this COVID and has shown also the importance of our mitigation in the climate change and our preparations for the challenges what we have in climate, whether it concerns the fighting against the black carbon, whether concerns about the extreme weather conditions, but they all have an effect to our lives, and they are all something that we have to address together. And this also will be definitely one of the key priorities, even the red line in the Finnish presidency, that we're looking forward. What can we do together, and how can we work together? These all, climate is another side of the health question, and health is another side of the coin in the climate. And I'm very happy and proud that during the Norwegian presidency we will be approving in the minister meeting the action plan for the climate change for the Barents region that has been prepared in Environment Committee, and I think that will also be a very crucial tool for our future actions. What needs to be done. To try to summarize my short comment in the very beginning, because the headline I think was putting forward to me is the silver lining in the COVID crisis. I think the silver lining, if we had there, is that we've been forced to have a transformation of our working life. I think the digital leap that we would otherwise would have to need done anywhere has been done now because of the COVID. So we will have a different kind of setup for our cooperation also in the future. Another silver line is, I think, the need for the cooperation, need for the tighter cooperation and coordination of action is a self-evident fact for the future, whatever challenges we'll be facing in there. And a third one is what I would say also, I think the need for the coordination, cooperation and coherence between the various players in the Barents has become a more self-evident, and we need to utilize these structures that we have, whether they are Arctic Council, Barents Euro-Arctic Council, Barents Regional Council, Nordic Council of Ministers, or the European Union Northern Dimension policies. Coordination between these all various players and pooling their resources, I think is the factor that will be looking completely different than we have done before. And this might be the few silver linings that we can see there, but utilizing them the best possible way, we do have a possibilities for the success stories and strengthening further the cooperation that we are doing in the Barents and having even more concrete results for the benefit for all of us. With these few words on my side, thank you very much for this opportunity to participate, and I'm looking forward very much for Markus' speech. I presume will be the next one.
Thank you very much, Jari. Unfortunately, Jørgen Gyllenblad is experiencing some technical trouble. We hope to have Jørgen with us soon. Now I'm very pleased to introduce the head of the International Barents Secretariat, who has an excellent viewpoint for the whole Barents Cooperation. Please, Markus Carlsen, the floor is yours.
Thank you very much, Madam Chair. Before I start, let me convey my hopes and thoughts to the victims of today's tragic event in Stockholm or in Gothenburg as they are unfolding. I'll start out with telling you a little bit about the International Barents Secretariat. This is the whole Secretariat. Thanks to a voluntary contribution by Norway and a voluntary contribution by Finland, we have been able to strengthen our Secretariat this year. From Finland, we have gotten an advisor on culture, education and youth, and from Norway, an advisor on youth and indigenous issues. Our main role is to support the formal Barents cooperation. This is an organizational chart of the whole cooperation, which I'm sure you know. For your information, this chart will soon be amended. The chairmanship has initiated a reform that will simplify the structures a bit. At the Secretariat, we provide the working groups, the national level, the regional level, with a platform for digital meetings, where you can have meetings in 2 or more languages. We are also assisting the Barents Cooperation in profiling activities in both media and on social platforms. The document archive of the cooperation you will find in the Secretariat, and we are also providing logistical support. With the increase in staff, we have been able to strengthen our support, in particularly the working groups. We have now dedicated staff to each working group in the Barents Cooperation. And to our colleague Roy, I have marked your working group in yellow. He is the focal point for health and social issues. To the situation regarding COVID, I took this picture. A reminder 1.5 years ago, when we all hunkered down in an office and being very unsure of what comes next. I'm very happy to say, though, that the chairmanship quickly turned around, switching from physical to digital meetings. And meetings have indeed continued. As Jari mentioned, COVID has demonstrated to us that even though the borders are closed, there is a need and a wish for cross-border cooperation. For us, this meant a very steep learning curve, becoming a facilitator for digital meetings. And I'm also now very happy to announce that we are also able to provide multilingual meetings. And we even had a digital intern this spring. The digital meetings are in many cases easier. However, and this has been conveyed to us by several, in particular the youth and the Indigenous group. The important informal task is absent. And there is a lack of in-depth contact with people. And what also Jari mentioned, we have a cross-border cooperation with no borders to cross. I believe it's very important that several working groups, including the working group on health and social issues, now are conducting surveys on the impact of COVID. And Michael, the chair of the regional committee, will later on inform you about the study that they are conducting among youth in the Barents region. In a broader context, allow me also to mention that OsloMet is currently examining the impact of Norwegian-Russian collaboration on health and social welfare in the Barents region since 2000. They will be looking at projects, programs, and work of the committees, councils, and expert groups engaged in this collaboration, and how it has affected the quality and durability of networks between authorities on various levels. While we now are gradually reopening nationally, I believe that we would still have to bear in mind that the reopening will most probably not be symmetrical. I believe we'd also have to bear in mind that the Barents region, as of now, is sort of split in two, with 2 different vaccination and vaccination certificates regimes. As Jari mentioned, and in a longer term perspective, I also believe that pandemic has provided us with an opportunity to become digitally competent very rapidly. In the future, when the situation is back to its new normal, I believe that digital meetings will have a more prominent role. For instance, the threshold for organizing digital meetings are much lower than organizing physical meetings. However, physical meetings are also very important. And there are many activities that are just too difficult to organize in a digital manner. Let me end with just briefly inform you that we are currently working on a new website for the Barents Cooperation. We are also developing a profile handbook. This will be available for all working groups and all structures in the Barents Cooperation, and I hope that this will help us in adopting a unified approach in informing about all the important activities that are ongoing, and which again will help us in strengthening the brand name of the Barents Cooperation. The new website will also entail that we will get a new web address. You will be informed in due time when that happens. Then it remains for me to just say that we look forward to a very active Finnish national chairmanship, and we also look forward very much to support the NENET's regional chairmanship in 2021 to 2023. Thank you.
Mr. Moderator Jörgen Gyllenblad, the floor is yours.
Thank you very much. I apologize for this technical disturbance that we had here in Stockholm. It has nothing to do with anyone else than ourselves, I regrettably have to say. But now I'm back, and again, sorry for this. Thank you, Mr. Council, for your presentation, and also Mr. Wilén. I didn't have opportunity then to listen to your presentation. I'm sorry. Now we turn over to the next chapter of this first session, the Barents HIV and Tuberculosis Program, and I give the floor to Mr. Dimitri Titko, that is our coordinator for the Barents HIV and TB program. Please, the floor is yours.
Большое спасибо, Йорген. Я надеюсь, меня слышно. И прежде чем перейти к своим слайдам, я хотел бы еще раз представиться. Меня зовут Дмитрий Титков. Я представляю на данной встрече Barents программу по противодействию распространению ВИЧ-инфекции и туберкулеза в Баренцевом регионе. Я являюсь координатором этой программы, и я представляю Финский национальный институт здравоохранения и социального благополучия, THL. Я прежде всего хотел бы поблагодарить организаторов этой конференции за возможность присутствовать на этой встрече, за возможность рассказать о том, как осуществляется наша программа и какое воздействие оказывает пандемия COVID-19 на сотрудничество в области противодействия распространению ВИЧ-инфекции и туберкулеза. И прежде всего я хотел бы сказать, что я очень-очень рад вас видеть всех, пусть и через экран. А теперь я хотел бы перейти к своим слайдам. Я надеюсь, слайды видны на ваших экранах. И в течение ближайших 15 минут я расскажу о, в принципе, 3-4 вещах. Прежде всего, я хотел бы остановиться в нескольких словах о том, какой эффект пандемия COVID-19 оказала на услуги, на работу по профилактике и лечению ВИЧ-инфекции и туберкулеза в Баренцевом регионе. я хотел бы также остановиться отдельно на тех эффектах или на том влиянии, которое оказала пандемия на сотрудничество, международное сотрудничество в области ВИЧ-инфекции и туберкулеза в Баренцевом регионе. Некоторые моменты, некоторые аспекты я хотел бы отразить в своих слайдах, которые касаются возможностей сотрудничества на перспективу. Ну и в последнем слайде я хотел бы подвести уже какие-то итоги, какие-то основные моменты хотел бы отразить уже на последнем слайде. Я хотел бы сказать, что в своей презентации я использую результаты того анкетирования или тех опросов, которые были проведены среди участников, среди партнеров нашей программы, как со стороны северных стран или нордических стран, так и со стороны России. Ну и если вернуться чуть-чуть в историю, 1,5 года назад, конечно же, изначально была высока степень неуверенности и страха перед неизвестностью. Были, конечно же, нарушены те услуги, которые существовали для больных и для людей с ВИЧ-инфекцией, с туберкулезом. Но, тем не менее, постепенно это переросло в какую-то новую рутину. Тем не менее, COVID-19 продолжает оказывать влияние на больных и на услуги, на функциональные обязанности персонала и на объем рабочего времени. И вопрос, ответ на который до сих пор нам, скажем так, неизвестен, это в какой степени COVID-19 действительно оказал влияние на выявление новых случаев и сколько из той статистики, из того снижения, которое мы видим по ВИЧ-инфекции, по туберкулезу, это просто замаскировано COVID-19. И, как я уже сказал, далее на слайдах будут представлены результаты наших опросников, сделанных в мае этого года и в сентябре, буквально 2 недели назад перед данной встречей. И вопрос, и тут текст представлен как на английском, так и на русском для удобства, скажем, аудитории. Насколько сильно, по вашему мнению, пандемия повлияла на или нарушила возможности оказания медицинских и немедицинских услуг для клиентов? И подавляющее большинство, конечно же, ответило утвердительно в том плане, что влияние COVID, конечно же, оказал. Мы спрашивали еще весной этого года, какой период пандемии, первая волна, скажем, весна 2021 года или осень 2021 года была сложнее для вашей организации, для вас. Ну и большинство, конечно же, ответило, что именно первый период был полон страха и неуверенности и неизвестности. Уже свежие данные 2-недельной давности, когда я задавал вопрос, насколько вы чувствуете, что с точки зрения вашей работы ситуация изменяется уже, скажем, возвращается в норму. Ну и, как вы видите, подавляющее большинство респондентов, как и со стороны российских субъектов Баренц региона, так и со стороны северных стран, ответило, что ситуация меняется к лучшему, но пока еще медленно. И то есть, скажем так, мы можем говорить об изменении ситуации, если мы говорим именно с точки зрения работы по ВИЧ-инфекции и по туберкулезу, но эти изменения пока еще очень незначительны. Поэтому тут говорить о выходе из, скажем, коронавируса и из пандемии COVID-19 еще пока рано. Если говорить о эффекте пандемии именно на сотрудничество в области ВИЧ-инфекции и контроля за распространением туберкулеза, безусловно, нужно признать, что сотрудничество во всех секторах, не только в сфере здравоохранения, пострадало и было нарушены какие-то связи привычные связи сотрудничества, но именно в сфере здравоохранения эти изменения или это влияние было наиболее драматичным, и в основном это связано с тем, что многие специалисты, медицинские работники, особенно инфекционисты, а с инфекционистами мы работаем в нашем сотрудничестве, им пришлось, они, скажем, были переориентированы на другие задачи, связанные именно как раз с ковидом. И может быть это совпадение, но за прошедшие 1,5 года достаточно много наших, скажем так, давнишних партнеров, я имею в виду именно людей, они либо закончили трудовую карьеру и вышли на пенсию, либо поменяли место работы, что тоже в свою очередь оказало определенное влияние. Конечно же, широкое использование цифровых инструментов или инструментов цифрового общения принесло ценный опыт. Может быть, без пандемии этот процесс трансформации, он бы продолжался намного дольше. И как наши партнеры отметили, есть, конечно же, преимущества и, скажем, недостатки онлайн-коммуникации. И как ответили, опять же, наши партнеры, безусловно, в будущем какие-то мероприятия, встречи можно и дальше проводить в удаленном режиме, но периодически хотелось бы встречаться и вживую. Если говорить конкретно, то в рамках нашей программы, у которой есть руководящий комитет, он проводит, как и ранее, регулярно встречается, безусловно, в онлайн-режиме, но тем не менее все партнеры всех субъектов из всех регионов участвуют в наших встречах. Организация Telehealth International из Норвегии осуществляет проектную работу по контролю за распространением туберкулеза, и я знаю, что Анна Эллерсон, которая представляет эту организацию, она после меня уже, я думаю, более подробно остановится на тех проектах, на той работе, которую они проводят, но тем не менее хотел бы отметить, что их проекты, они в основном затрагивают такие вопросы, как укороченные режимы терапии, лечения туберкулеза в соответствии с рекомендациями Всемирной организации здравоохранения. Это пациент-ориентированные подходы, включая видеоконтролируемое лечение, ну и также образование. Ну и наш институт, или институт, который я представляю я, THL, в начале 2020 года, как раз буквально за месяц до начала пандемии, начал проект, в основном образовательный проект по ВИЧ-инфекции, по туберкулезу. И в рамках которого идет разработка, например, интернет-курса по профилактике и лечению туберкулеза и ассоциированных инфекций. Ну и вот буквально через неделю с небольшим мы проводим вебинар, посвященный роли первичного здравоохранения в профилактике, раннем выявлении и консультировании по вопросам ВИЧ-инфекций и профилактики туберкулеза. И будем рады, если соберется обширная аудитория. Над этим мы как раз и работаем. Ну и что касается перспективы, некоторых моментов, некоторых аспектов, на которых я хотел бы остановиться, опять же, на основе наших опросников. Безусловно, все партнеры считают, что сотрудничество именно в этой области, в Баренцевом регионе, должно продолжаться. То есть все видят большое светлое будущее. Есть интересные моменты, и на следующих слайдах я хотел бы отразить, как раз тут есть разбивка по, скажем, респондентам из северных стран или нордических стран и из России. Насколько вы оцениваете возможность, например, включения такой темы, как старение и пожилых людей в качестве целевой группы в сотрудничестве с вопросом, связанным с ВИЧ-инфекцией и туберкулезом? И, как вы видите, в принципе, тут есть над чем работать. То есть, если северные страны они считают эту тему более-менее релевантной, то в России, учитывая средний возраст, скажем так, смертности пациентов с ВИЧ-инфекцией с туберкулезом, то, может быть, эта тема еще не настолько актуальна. Как вы оцениваете возможность включения молодежи как темы и целевой группы? Тут, конечно же, очень высокие оценки именно необходимости и важности, и актуальности работы с молодежью. Если мы говорим о теме климатических изменений и включения сотрудничества именно по вопросам ВИЧ, инфекции и туберкулеза, то тут оценки пока низкие. То есть, опять же, это не означает, что здесь нет, скажем так, общих тем или общих вопросов, но пока они, скажем так, с первого взгляда не видны. Если мы говорим о такой важной теме как раз для инфекционистов, это инфекционная профилактика и контроль, то, безусловно, здесь эта тема очень-очень и очень важна. Но и тема, скажем, мобилизации и готовности при чрезвычайных ситуациях, пандемиях, именно в рамках сотрудничества по ВИЧ-инфекции и туберкулеза, опять же, здесь, скажем так, по мнению наших партнеров, оценки не настолько высоки. Ну и тема ковида, она тоже, тут очень большая разница. То есть, по мнению российских партнеров, эта тема очень важна и может быть включена, в то время как в северных странах актуальность ее очень-очень средняя. Но и вопрос, насколько полезными и интересными вы находите следующие формы и форматы сотрудничества. Тут тоже интересный слайд, опять же, который мы будем обсуждать уже на нашей группе среди наших партнеров и, в принципе, который нужно учитывать и в будущем. Какие формы, форматы и подходы к работе могут быть использованы. И тут видно, например, что, такие вещи, как проектная работа, она российскими респондентами оценивалась намного выше, чем северными странами. Заседание руководящего комитета программы также, скажем, большой разброс оценок между российскими респондентами и респондентами из северных стран. Но в то же время, если мы говорим про такие вещи, как образовательные мероприятия по определенным вопросам для определенных целевых групп, то здесь высокие оценки и как со стороны российских респондентов, и со стороны северных стран. То есть есть над чем работать, и поэтому буквально в нескольких словах сеть сотрудничества по борьбе с ВИЧ-инфекцией, с туберкулезом в Баренцевом регионе функционирует, работает, есть желание, есть энтузиазм и есть интерес сотрудничать и дальше. COVID-19 и некоторые другие факторы, конечно же, ставят под угрозу, скажем, интенсивность сотрудничества. Большое значение для сотрудничества и для его, скажем, плавности имеют не только общие темы интереса, но и общие формы и методы работы. Критическими аспектами для сотрудничества именно на локальном уровне, на местном уровне являются такие вещи, как практичность и конкретика. То есть какая-то результативность у сотрудничества, она должна быть. Может быть, не так будет просто, скажем, интегрировать те глобальные или региональные приоритеты в контекст существующей тематической программы по ВИЧ и туберкулезу. На этом я хотел бы закончить свое выступление. Большое вам спасибо за внимание. И еще раз хочу сказать, очень был рад вас видеть и желаю всем интересной и продуктивной общения и продолжения данной недели. Остаюсь с вами. Спасибо.
Thank you very much, Dmitry, for the presentation of this very interesting service that you have been done and your conclusions for the future work. Now we turn over to Ms. Anna Eilertsen from LHL International to make a presentation of the influence of COVID-19 on the current TB projects in Northwest Russia. Please, Anna.
Добрый день, уважаемые коллеги. Спасибо за представление и приглашение. У меня всего 5 минут, поэтому благодарю особенно Дмитрия за подробную презентацию. Я надеюсь, меня слышно? Да. Итак, секунду. LHL International. Мы – это небольшая некоммерческая организация, которая отпочковалась в свое время в 2013 году от большой пациентской организации LHL в Норвегии. Это общество помощи больным туберкулезом, и сейчас еще это болезни сердца и легких. Работаем мы при поддержке нескольких крупных организаций норвежских, направленных на сотрудничество в целях развития, Министерство здравоохранения и социального развития Норвегии, а также активно привлекаем больших и маленьких частных и государственных спонсоров. На сегодняшний день наши проекты идут в Африке, Румынии, в Норвегии и в России. В России наш главный, давний, надежный партнер – это благотворительный фонд «Легкое дыхание» в Архангельске, естественно, региональные медицинские учреждения, Северный государственный медицинский университет, очень важный наш партнер, и Министерство здравоохранения тех областей и регионов, в которых у нас на сегодняшний день текущие проекты, а именно Мурманская, Архангельская область и Республика Коми. Текущие проекты, которые у нас есть в рамках сотрудничества в Баренц-регионе, финансируются Норвежским министерством здравоохранения. Это проекты в Мурманске, в Северодвинске Архангельской области и Сыктывкаре. А также идет сейчас курс по проведению научных исследований в Архангельске, но с привлечением специалистов со всей России. К сожалению, первые последствия ковида – нереализованные проекты. То, что здесь в моей презентации отмечено красным, как вы понимаете, это негативное влияние ковида на ведение наших проектов. Это были те проекты, где предполагались физические встречи. Например, наш очень популярный тренинг по технологии общения. Его просто невозможно было, к сожалению, проводить онлайн, потому что там много интерактивных упражнений, групповых занятий и так далее. Это встречи Норвежской национальной профессиональной группы по мультилекарственному устойчивому туберкулезу с российскими коллегами. И семинары, серия семинаров по обмену опытом между несколькими норвежскими организациями и их российскими партнерами. Но мы очень надеемся, что эти проекты мы сможем провести чуть позже, возможно, уже в следующем году. Итак, по нашим основным компонентам, то, что мы делаем и как это повлияло на работу, на нашу работу, как COVID повлиял. Очень много уже, это перекликается во многом с тем, что было сказано предыдущими ораторами. Итак, в области повышения компетентности медработников очень важный наш компонент наших программ. То, что было возможно, мы перенесли на онлайн. Конечно, здесь очень много плюсов, в том числе развитие гибкости в подходах. Нас этому COVID научил очень быстро. А также у нас у всех с вами развились гораздо лучшие технические навыки, ну и, естественно, эффективность. Мы экономическая эффективность, экономия ресурсов, времени, ну, это понятно. А также развитие креативности в некотором роде, поскольку мы придумали даже некоторые формы совершенно новые, те, которых раньше не существовало, и, скорее всего, мы их оставим в будущем. Ну, про недостатки уже много было сказано. Вторая очень важная часть нашей работы – это работа с уязвимыми группами населения. Раннее обнаружение туберкулеза и латентного туберкулеза, а также превентивное лечение в соответствии с рекомендациями ВОЗ. Что здесь было, это очень сильно пострадало, к сожалению, но что здесь было хорошо, если можно так сказать, симптомы туберкулеза довольно похожи на симптомы ковида. Поэтому те люди, которые не обращались за помощью в течение очень многих лет, пришли в больницы, и чтобы провериться на ковид, и поэтому туберкулез тоже был обнаружен. Ну, а в 2020 году, естественно, ограничительные меры повлияли на работу, поскольку доступ просто к услугам здравоохранения для всех групп населения, в том числе уязвимых, был снижен. Но надо сказать, что в 2021 году мы уже вернулись на прежний уровень. Просто меньше людей посещало медицинские учреждения из страха заразиться. К сожалению, финансовая нестабильность увеличила количество пациентов, нуждающихся в поддержке, ну и безработица. Просто-напросто количество людей в уязвимых группах увеличилось. Пациентоориентированные технологии, ну, то, что шло раньше, мы внедряли уже несколько лет, но сейчас в связи с ковидом они получили просто более широкое распространение, в том числе во всем секторе здравоохранения, не только в сфере туберкулеза и ВИЧ-инфекций. К сожалению, здесь то, что негативно повлияло, невозможность приобретения просто средств связи, таких как телефоны и другие гаджеты, для уязвимых групп населения, участие из них, но это мы смогли обеспечить в рамках индивидуальной социальной поддержки. Но и, к сожалению, растущая стигма в отношении инфекционных заболеваний в целом, COVID придал этому определенную силу, но с этим мы тоже активно работаем путем распространения, в том числе информационных материалов, брошюр, которые пользуются большим спросом, надо сказать. У нас есть такая форма работы, как индивидуальная социальная поддержка. И положительным фактором здесь было то, что многие люди ощутили потребность в ней, и это придало им сил соблюдать в том числе режим лечения и успешно его завершить. Так, ну и, конечно, проектные визиты пострадали больше всего, потому что ни мы не можем сейчас навестить наших партнеров, ни наши партнеры из Архангельска не могли навестить тех, с кем мы сотрудничаем в регионах. Но, с другой стороны, мы стали гораздо чаще и подробнее общаться онлайн. Надеемся, что в следующем году, может быть, даже в этом уже мы все-таки где-то встретимся. Перспективы сотрудничества, на наш взгляд, ну, это безусловно важно. Обмен опытом по проектам, особенно по детальным проектам, взаимно обогащает и норвежскую, и российскую сторону. Мы очень надеемся, что в следующем году сможем запустить те проекты, которые были отложены. Обмен опытом на регулярных мероприятиях для всех стран Барents региона мы всегда почерпаем что-то новое, причем все наши партнеры. Большая благодарность лично Дмитрию как организатору за то, что он нас везде приглашает. И, ну, как одна из целей наших проектов – это устойчивое развитие за счет российского финансирования. И это в последние годы тоже активно развивается у нас, к счастью. Вот один такой проект наши партнеры в Архангельске смогли осуществить. Окей. Так, мне, видимо, пора заканчивать. Ну, это последний слайд. За счет местного финансирования провели тренинг по профилактике эмоционального выгорания медработников с нашими материалами. Спасибо большое за внимание. Обращайтесь, если что.
Thank you very much, Anna Eilertsen. As you know, youth is very high on the agenda under Barents Euro-Arctic Council and the Barents Regional Council, and this is something that both Norway and Västerbotten have underlined, and Sweden before that, and we know it will also be a focus for the Finnish chairmanship. It's a pleasure for me to introduce the next speaker, Marit Inga Smuk, who will address the youth perspective on the Barents program on children and youth at risk. Please, Marit Inga Smuk, the floor is yours.
Thank you, Madam Chair. Dear ministers, friends and colleagues of the Barents region, Boras, my name is Marit Inga Smuk. I'm the new Indigenous and Youth Advisor at the International Barents Secretariat. I started in this position for 3 weeks ago. I will share my screen with you first. Yeah. I'm first of all very grateful to be participating here to tell you more about the youth cooperation in Barents region. My main function in this position is to support the international youth organization, Barents Regional Youth Council, shortened as BEAC. BEAC's function is to unite the youth within the Barents region. So the youths have a platform where they can cooperate about issues that concerns them here in Barents. BEAC's main purpose is to work towards new opportunities and good living conditions for this main target group. Within the fields like culture, education, environment, entrepreneurships, and also health and social issues. This picture was taken in 2018 when BEAC arranged their annual event, as they do once a year, to gather all the BEAC members and the youth in Barents region to discuss youth issues. And to attract youth interests, it must be done in a fun way, through fun bonding activities. Each year they have a new theme. In 2018, the theme was across cultures. Every activity that the BEAC does is based on their core values. That is tolerance, cooperation, reliability, justice, and respect. So how has the BEAC been during this pandemic? The year 2020 started very ambitious. The BEAC board went to Oslo at the beginning of the year when they were invited to attend the Committee of Senior Officials meeting for the very first time. They also held a presentation for the Norwegian Minister of Foreign Affairs, and they got invited to participate in the joint working group on youth meeting. And one of the outcomes of this meeting was a decision to organize a big multinational youth conference that the Norwegian chairmanship wanted to implement and finance in their chairmanship period. We will come back to this conference later in the presentation. BEAC found it very cool and fun to be invited to these meetings, and the chair suggested having 3 meetings with the joint working group on youth in 2020. The BEAC board met also at the end of January under the Arctic Frontiers Week in Tromsø, where they hosted a youth workshop titled "The Force of Youth in Building Tomorrow's Arctic." to build awareness and create a discussion around this topic. But then suddenly the pandemic stopped all activity. BRIC postponed their activities as it was difficult to get anything done, especially considering cross-border movement and physical meetings. In August 2020, BRIC board organized a workshop in modern presentation of technique. This was for the other members of the Youth Council. The workshop was meant to create more interaction and learning in times of the pandemic. It was a very good workshop, but unfortunately, it didn't attract many participants. The assumed reason for this is the timing. Usually the majority of BRIC members are on summer vacation until the end of August. So the BRIC board concluded that it's not a good idea to organize events during the summer. So in year 2020, they went from a very eager and ambitious state of mind into a lockdown with no activity for the rest of the year. This picture is from the last annual event that BRIC did. It was located in Vuokatti, Finland in 2019. We will come back to the annual event later in this presentation. Over the year 2021, BRIC has experienced that the pandemic hasn't only affected them negatively, but it has also brought some positive side effects. Since people got used to do meetings digitally, they experienced that they got a higher attending for the meetings. BRIC has also aimed a closer collaboration with the chairmanships, regional councils and CSO. Here in the picture at the CSO meeting in Oslo. They have also gotten more administrative support by IBS. By that, BRIC has gotten more visible and gotten more focus and been including in cooperations with the parent bodies and the overall strengthened on focus in youth in the Barents Cooperation, which of course is very positive and motivating for them. It is important that they get to feel that their voice and opinions matters. Last year, the youth from Nordland, Troms and Finnmark in Norway got invited to give their suggestions to the Norwegian government, and they work on the white paper on Arctic policy. It was, of course, important for the youth to highlight the international youth cooperation, how to build on differences between the youth in the Barents region, and how to build on trust. So back to the youth conference. Norway as chair of the Barents Euro-Arctic Council and Västerbotten as chair of the Barents Regional Council hosted the digital version of Barents Youth Conference on the 1st of September with the title Physical and Mental Health Among Youth in the Barents Region. And BRIC has received a lot of positive feedbacks afterwards from young people. They were very grateful that this discussion of such a sensitive topic was lifted on the high level. They also emphasized that they felt more seen. Please feel free to watch the recording of this conference at YouTube. So looking forward for what's up for the rest of the year, we must remember that we are still in a pandemic. Therefore, the upcoming events, youth events, will still be partly digitally. On October 26, a Barents Youth Summit will be held in Tromsø. This is in connection with the ministerial meeting where Norway will hand over the chairmanship to Finland. And this is at the initiative of the Norwegian chairmanship. At this summit, will young people from the Barents region have the opportunity for a direct dialogue with the ministries and issues that they consider important to them. I also have to mention that this will be the first youth summit since the Barents Cooperation was established. Looking forwards, on November 30th, a Barents youth meeting will be organized in Oulu, held under the Finnish presidency of the Barents Area Arctic Council. And in December, on December 3rd to 5th, will the annual event and annual meeting of BEAC be held here in Kirkenes. Because of the pandemic, will only BEAC members and invited guests be invited to be physically in Kirkenes. Other participants will have to do a pre-registration for the online event. This year's theme will be Indigenous Youth in Barents region. We're looking very much forward to this upcoming events. BEAC's main goal is to get stronger as a council. The special thing about the youth cooperation is that even though it stretches over a large area, the youth still experience the same issues and they all share the same interests for their region. We have a work to do with gaining more members to BEAC, and how to achieve that. We must meet the youths where they are, use the platforms that are relative for them, and through projects that are interesting for them. It is important that the projects make it interesting for youth to stay and live in the Barents region. We need to get the youth and the young people to realize how important they are for the Barents future, that they have the power to affect their future here. Through such kind of projects, BEAC is hoping to prevent youth migration from the Barents region. During my time in IBS and this position as Indigenous and Youth Advisor, I hope to achieve a stronger and more recognized Youth Council by building the structure within the organization. And in collaboration with BEAC, we will spread the word and recruit even more committed young people to join and take part in the Barents Cooperation. I am looking very much forward to work with you and our future generation and issues that are in their interests. Feel free to follow the Barents Youths on social media. And you find them on Facebook, Snapchat, Instagram, and also on YouTube. Thank you for listening.
Thank you very much, Ms. Marit Ingersvåg, for your presentation, and I apologize for missing the first part in your presentation. Now we continue with the program on children and youth at risk, and we listen to Mr. Mikael Bergström on children's health in the Barents region. The floor is yours. Thank you.
Thank you very much, Jörgen. My name is Mikael Bergström, and I'm the chair of the Barents Regional Committee, and I'm from Västerbotten, and we are now sharing the regional cooperation together with Norway as a national chair. Health and youth are two of the topics of the Västerbotten chairmanship, and a concrete priority is children's sport and health. Being physically active can help us live healthier lives. However, a big challenge for parents, schools, and healthcare is to give boys and girls an equal and healthy lifestyle. That has been even more challenging during last year's shutdown of many sports and youth activities. And that is something that we think is similar all over the Barents region. And we are now conducting a study on the children's physical health in the Barents region. The study is done by consultant company called VSP. And this study then refers to the situation of for the children of the Barents region with focus on physical health, and we hope the study then aims to present the situation of today when it comes to physical health among the children in the region. We will describe which goals and strategies concerning children's physical health and health that exists on national, regional, and local level. We will also identify and describe best practices, good examples to increase children's physical health. And in the end, we will also propose a concrete toolbox with tools for regional and local level to break what we think is the negative trend with less and less physical activities among children. And in order to do this, we have chosen 2 regions per country, and from each region 2 municipalities. Then the consultant have conducted in-depth interviews with both regional and local representatives to understand the current situation and what can we learn and share between the regions. The consultant has also been in contact with national representatives. And these findings and when the findings and conclusions now are being identified, we are arranging a workshop on the 12th of October. And during this workshop, the VSP will present what they think is themes from the different regions, both in terms of the status of children's physical health, as well as themes relating to good practices and policy recommendations. Regional and national representatives from the Barents region are invited then to this workshop when they will get a chance to validate the conclusions and comment on the aspects that we have found. And this is also a way for us to ensure that the final findings and recommendations will be relevant to the respective national, regional, and local stakeholders. And if there are any persons here with us today at this meeting that would like to take part in the workshop but have not yet received an invitation, please contact me. And after this workshop, then the consultant will finalize a report for this study, including recommendations for the road ahead, because this is something that we find it's very important that this will not just be a report and a presentation, that we will also like to do something in the future. So we will see what comes out of that. And the findings from this study will be presented at the Barents Regional Council meeting in Tromsø on the 25th of October. Thank you, Chair.
Thank you very much, Mikael. Very interesting work indeed, and looking forward to the report and the presentation on the conference on the 25th of October. Now we turn over to Ms. Unni Nygård from the Norwegian Directorate for Children that will make a presentation on measures and experiences from Norway. The floor is yours.
Thank you very much, and good morning, everybody. I will give you some update on the COVID situation concerning children, vulnerable children and youth, and I will try to share my presentation. Okay, first of all, the Ministry of Children and Families Mission Norwegian Directorate for Children, Youth and Family Affairs, Bufdir, to coordinate relevant directorates to monitor, evaluate and report and give recommendations on services to vulnerable children and families. The coordination group reported to the ministry and delivered 13 reports during the pandemic. Okay, so what happened? At the onset of the pandemic, all services shut down at once and simultaneously. Services that normally support and safeguard all children, and especially children and families at risk. Vulnerable children were suddenly confined in their homes without daily contact and support they needed and were used to. So, we had two main objectives and two main thoughts to deal with simultaneously. First of all, we had to implement necessary measures, prevent infection, safeguard children and staff. And secondly, we had to do all this, but also minimize negative effects on children and youth. So what did we do? It was necessary that the decision makers agreed upon the fact that schools, kindergartens, and all services to vulnerable families and children should stay open and available in a safe manner and as soon as possible. It was also important that child protection services was defined as a social crucial service to safeguard children at risk. That meant that people working in the child protection services would have a facility for their children so that they actually could go to work. Information measures had to be implemented so that children and youth in need knew how to contact and who to contact in relevant services. Children has also a right to participate also in times of crisis, and we had to make arrangements to secure that issue. So what do we know now? The National Institute of Public Health has delivered a rapid review of the consequences of COVID on children's health and everyday life. And to sum it up shortly, the report determines that most children appeared to experience improvements in some areas of life, as well as deteriorations in other areas. However, a small minority, often comprised of already vulnerable children, experienced deteriorations in most areas. And these areas are, for example, mental health issues, learning difficulties, and family relations difficulties. So the conclusions, summed up very shortly, is that all children are vulnerable during a pandemic, and some children are more vulnerable in a crisis. Challenges are more challenging during a pandemic, and we need to know more about long-term consequences of the pandemic. But it is also important to remember the opportunities this situation has given us, because we have gathered new experiences. We have cooperated in different ways and experienced new ways of problem solving. Thank you very much.
Thank you very much, Ms. Unni Nygård, for this presentation and your conclusions. With that, we go over to the next chapter of this section on the Barents program on new technology and methods. And first out on this round is Dr. Sasha Sereteli, who is the coordinator of the Barents program on new technology and methods for health in sparsely populated areas. I give the floor to you, Sasha, please.
Thank you very much, Jörgen. Good morning to everybody. I'm very glad and pleased to see all of you today, and let me now share my screen and presentation. Yes, so as it was mentioned, I'm a coordinator for the Barents program on the new technologies and the health in the sparsely populated areas. And if you remember during his first presentation, Mr. Jan Villen in Finland, he put this question that it is interesting what kind of crystal ball the Norway had then the Norway got the chairmanship of the BEAC, and they decided that health will be one of the priority area. The same can we say about this program, because in 2018, when we started to discuss the establishment of the new program on the digital health, nobody even thought that it will be the COVID and that the digital health becomes such an important tool in our life. So, but then in 2018, when we started to discuss, it was clear for everybody that despite the differences between the regions in the Barents area, the key theme for the healthcare in sparsely populated areas were more or less the same for all the regions. It was access to the healthcare facilities, and that was the primary issue. Even in the countries where the majority of the population lived in the rural areas, the resources were mainly concentrated in the cities. And while the healthcare system contributes to citizens' well-being, it in turn is an important factor impacting people's decision to live in the regions. It was clear at that time that the digital solutions can play an important role in the Barents regions, and we wished to take advantage of the new technologies and ongoing solutions. That was the desire behind the initiation of new program, and that you can see it was adopted in 2019 during the ministerial meeting in Oslo. What are the program aims? We had a two aims in our program. First is collect and exchange information and knowledge on the best practices of cost-effective solutions to meet unmet healthcare needs in the rural areas. And second, sharing of the models for introduction of the health information technology in different fields of the health and care systems, including exchange, personnel, and education. We had three program objectives in our program. The first one was improved capacities of facilities and institutions to implement innovative e-health solutions. Then to map and identify best practices and innovative e-health solutions, which can be transferred, further and developed and integrated into healthcare systems in the partner regions, and then increase cooperation between the countries in the Barents region in the field of healthcare in sparsely populated areas. Until now, before I go to main activities, until now, what the program has done was that we have organized a high-level meeting on e-health, which was last year on December 8th. We had already 4 meetings of our steering committee. The steering committee is chaired by Norway and co-chair is Murmansk region. We have implemented already one assessment, and I will briefly inform you about the results of the assessment. And now we are developing a new project proposal that is the assessment of the digital governance in the Barents Euro-Arctic region. And we closely cooperating, continuing close cooperation with the Northern Dimension Partnership on health and social well-being on the same issues related to the digital health. Digital health is the use of the digital technologies to improve health. Developments in the area initially focused on e-health technologies that was used on information and communication technologies and to improve existing processes on communication, such as through the use of electronic health records. Then increasing power and prevalence of mobile devices later opened up a new potential applications of mobile devices for healthcare, which is called now mHealth, which seeks to empower individuals and provide new services such as the remote monitoring of health status and well-being. More recently, substantial increase in the volume and the variety of the available health data and data-driven tools to analyze big data, including through the machine learning, have emerged. The term digital health has become a way of referring to the concept of e-health, mHealth, and developments of the big data and the new technologies. When, as I have mentioned, when we established our program, it was in 2019. and everything was going well, and there was no COVID, and suddenly in the beginning of 2020, the COVID came. And there is like an anecdotal case when they are discussing about the digital transformation. The case is like, who led the digital transformation in your company? And everybody answers, that was the COVID-19. That was in November 2019. Before the COVID started, the program has decided to develop a questionnaire and make an assessment to find out what kind of digital tools we are using in our regions. But that was a period before the COVID-19. And as I mentioned, when the COVID started, we decided to add some questions to the assessment to find out not only what kind of digital solutions we have in our region, but also how the COVID has impact on its use. And now, as you can see, that is one of the examples from the North Karelia Social and Health Services. You can see that during the outbreak, telemedicine even helped provide mental health support. And as we can see from the North Karelia Health and Social Services, usage of the digital solutions, especially for psychiatry, increased by 71%, and general medicine by 61%, compared to the same periods of the previous year. The findings is significant because the behavioral health providers have always mentioned that it was impossible to use telehealth for the effective work in the mental health, but the COVID show that it is possible. As a result, such providers lagged even further behind the primary care. The assessment showed that technical foundation for the e-health solutions were widely available before the COVID-19 in the Nordic countries, and this helped the medical staff to leverage and extend their e-health capabilities during the COVID-19 response. The Russian healthcare system is structured on a historically necessary model of in-person interaction between patients and their clinicians. Clinical workflows have largely been developed to support and reinforce a face-to-face model of the care. Therefore, the usage of digital solutions was not so much used as the Nordic countries, as it was mainly related to the doctor and doctor contacts. What we saw is the significant shift in types and services and solutions provided, especially video consultations, remote working, and remote monitoring. It shows that enormous potential in the critical situation. The interesting question is now how much it will sustainable. Previously, digital solutions were more used for the older people that might be linked to the chronic disease. Now we can see it can be used for almost all age groups. The COVID pandemic has put the spotlight on digital health tools like the telehealth and remote monitoring, as the healthcare providers had to quickly pivot the technology to take care of the patients. Digital health tools during the COVID-19 have been used to support communication, four main directions: the communication, monitoring and surveillance, provision of health services, and vaccination rollout. Overall, for example, to combat misinformation, monitoring and surveillance, such as through the use of contact tracing apps or genomic surveillance, supporting provision of health services, notably through remote consultations or surge planning tools, and to facilitate the rollout of vaccination programs and monitor adverse reactions and vaccines. In many countries, a more recent development is emerging related to the potential role of the digital health tools to support certification of immune status and recovery. What are the main challenges regarding the provision of telehealth services in our regions? What was the outcome of our services? What we find out that, first of all, it was no surprise to see that the funding and the regulations are the top of this list. We have known that before, the reimbursement for e-health services was much lower than for the standard type of service delivery. This was a problem, and to increase the share of e-health and regulations were not pushing the usage of these services. When the pandemic occurred, leaders experienced rapid progress as regulations were loosened and reimbursement was increased. However, it is not clear yet whether government and private payers will maintain these reimbursement schemes after the pandemics, or whatever reimbursement will return to the prior level. As data become more painful and complex, there is also a need for improved understanding of its use while ensuring security and privacy measures. With the expansion of the use of technology and typical safeguards loosened, as well as more personal individual data being available to combat COVID-19, widespread concerns are about privacy and security. A clear and well-defined digital health strategies focused on transformation of care requires new governance structures and tools to support an intensified progress towards a robust digital health system. The ability of digital health tools to provide healthcare in different ways and in distance also raises questions about how these services should be reimbursed. There is yet no consensus about how to value services. Should a consultation with a doctor provided remotely be reimbursed at the same rate as in the personal consultation, for example? On the other hand, there may be limits to the scope of the consultation provided, which should suggest a reduced rate. At the same time, the patient or the doctor or both may value the accessibility of the remote consultation more highly, and it may ensure a cost for the system as a whole, which might suggest a single of higher rate. The three challenges for the digital health indicated by the first assessment under the BEAC program were the following. The first, governance in digital health systems. Second, easy real-time access to the actionable, secure, and trusted data. And third, actively coordination between participants on the healthcare continuum on behalf of the patient and families. It is important that policymakers, local stakeholders, and providers learn from the experiences of digital health implementation, use, and development during the pandemic. So far, the primary focus of the policy has been on removing limitations to uptake the digital health tools. But it is equally important now to identify policies and practices that can be put in place to create an enabling supportive environment for expanded use of the digital health tools. In order to retain added value from the greater use of digital health post-COVID-19, active strategies are needed now to build on the current momentum for use. In order to further assess how the Barents regions are dealing with the digital transformation of healthcare and how governing e-health, which involves decision-making as well as e-health management, is organized, the second assessment of so-called digital governance is now proposed by the group. The purpose of the assessment is to further assess how the Barents regions are dealing with the technology transformation on healthcare and how the governing e-health, which involves decision-making as well as e-health management, is organized. We will, during the assessments, we try to find out, answer the questions on three directions. What is the governance and workforce, how the interoperability is in our regions, and how is person-enabled health. Here I wanted just to share with you some examples of the questions which are in the assessment. For example, if the clinicians using secure devices in daily practice routines to enable collaboration with the other clinicians, or if the individuals are the primary decision makers and use digital tools to self-manage their health and wellness. The questionnaire is under finalization now. The steering committee will have their meeting in the middle of October, where the questionnaire will be finalized, and then we will develop the project proposal, which will be submitted for its financing. And I would like also to mention that in addition to this assessment, we are planning to include some trainings and seminars in our project proposal as a follow-up on the developments in the digital health in our regions. And to conclude, what we can conclude based on the assessment we have done and based on what happened during the COVID-19. First of all, we need to see that patients need to be included as partners and informed about the health technologies with a focus on how to access and use of such technologies must be considered to support vulnerable populations. It is important to improve health literacy, knowledge about digital technologies to ensure access to health services for every citizen. It is important that healthcare workforce require expertise and guidance to evaluate new technologies using processes grounded in real-world evidence. And of course, the reimbursement models must be designed to support and enable the required changes to clinician workforce competencies in managing digital mode. And to finalize and conclude, digital health tools offer enormous potential for health systems, and there have been many years of effort put in access to our health systems in order to facilitate and promote the use. This provided a context for making widespread use of digital health tools as part of the response to the COVID-19 pandemic, in particular for the communication about and the monitoring on COVID-19, in supporting the continued provision of the health services during the pandemic, and by potentially playing a part in the process of existing from pandemic-related restrictions. However, Many of these initiatives have been created very rapidly and on an exceptional basis. There is now a need for consolidation, evaluation, and learning to provide an evidence base for making best use of digital health tools in the medium term. The pandemic also rising policy challenges associated with the digital health, and the question at this moment for us remaining, how we can build on the momentum from the pandemic, which we all need to answer. Thank you very much for your attention and stay healthy.
Okay. Thank you very much, Sasha, and we promise to keep healthy as we can.
Thank you.
And thank you for the presentation on this very, very important program for the future of the Barents region, of course. And we will have possibility to come back later in our cooperation on these important topics. Now we turn to Mr. Andrei Panevin, who is Vice Director at the Barents Regional Hospital. That will give us an introduction to emergency preparedness, air emergency preparedness, air ambulance, and innovations in the provision of emergency medical assistance in the Arctic. Please, Andrei.
Добрый день, меня слышно? Да. Добрый день, меня зовут Андрей Паневин, я возглавляю службу медицинской катастроф и отвечаю за оказание экстренной помощи на территории Ненецкого автономного округа. Ненецкий автономный округ расположен на крайнем северо-востоке европейской части Российской Федерации в сложных климатических условиях. Территория округа занимает около 177 тысяч квадратных километров. Протяженность округа с севера на юг более 300 километров, с запада на восток почти 1000 километров. Количество проживающего населения составляет 44 300 человек. Из них коренного населения, это немцы, около 7500 человек. К особенностям нашего региона относится это удаленность населенных пунктов от окружного центра, суровые климатические условия, низкая плотность населения. В Ненецком округе она составляет 0,25 человека на 1 квадратный километр. Если взять сравнение с нашими региональными соседями, то в Республике Коми эта плотность составляет 1,95 человек на квадратный километр. В Норвегии 13,1 плотность населения на квадратный километр. В Швеции 20,1 человека на квадратный километр. Следующей особенностью является это отсутствие наземного сообщения как на территории округа, так и за ее пределами. Единственным постоянным транспортом остается авиационный. Преимущественно используется, конечно, вертолет Ми-8. В данных условиях при оказании экстренной медицинской помощи требуется намного больше усилий и затрат, как организационных, материальных, так и других. Для оказания экстренной медицинской помощи при заболеваниях, несчастных случаях, чрезвычайных ситуациях на территории Ненецкого округа организована служба медицины катастроф. Служба медицины катастроф является структурным подразделением Ненецкой окружной больницы. В состав службы медицины катастроф входит скорая медицинская помощь, которая у нас обслуживает городской поселок, город Наридмар и поселок Искатели, который является поселком городского типа. Затем непосредственно, затем санитарная авиация и телемедицина. Существенная роль в оказании медицинской помощи жителям Ненецкого округа с жизнеугрожающими состояниями принадлежит санитарной авиации. Зона ответственности санитарной авиации – это территория Ненецкого автономного округа, в том числе острова в Баренцевом море, вахтовые поселки в нефтедобывающей отрасли и часть Северного морского пути. Полеты выполняются в круглосуточном режиме. Очень частые вылеты происходят кочующим оленеводом в стойбище. И отличительной особенностью данных вылетов является минимальная информация о пациенте и точном месте его нахождения. Вылеты выполняются по указанным координатам, но, к сожалению, они не всегда бывают верными. Данная ситуация усугубляется длительным поиском места нахождения больного и увеличением времени вылета, соответственно, и времени эвакуации пациента в нашу окружную больницу. Эвакуация всех пациентов осуществляется в единственное многопрофильное учреждение региона. Это Ненецкая окружная больница. Расположена она в городе Нарьян-Маре. Количество вылетов по территории округа и количество эвакуированных представлено в данном графике. В среднем в год мы совершаем более 250 вылетов по региону. В 2020 году количество вылетов эвакуированных пациентов увеличилось в связи с пандемией новой коронавирусной инфекции. Количество вылетов санитарной авиации на вахтовые поселки нефтегазовой отрасли составляет в среднем около 30% от всех вылетов по региону. В связи с региональными особенностями и ограниченными мероприятиями, введенными на территории Ненецкого округа, первая волна пандемии пришла с вахтовых поселков недропользователей, в то время, когда в прошлом году среди городского населения и деревенских жителей округа эпидемиологическая обстановка оставалась относительно благоприятной, спокойной. Отмечались лишь единичные случаи заболевания COVID-19. Система организации медицинской помощи в вахтовых поселках недропользователей, а также медицинской эвакуации с использованием санитарной авиации принесла положительные результаты. Очаги массового заболевания были локализованы, не было ни одного случая летального исхода на вахтовых поселках. Зоной ответственности санитарной авиации является часть Северного морского пути. Статистика вылета представлена на слайде. В среднем в год вылетаем на морские суда до 10 раз. В текущем 2021 году мы совершили уже 8 вылетов и эвакуировали 10 человек. Преимущественно это пациенты с травмами, острыми заболеваниями, в том числе уже из COVID-19. При эвакуации с морских судов при наличии посадочных площадок мы эвакуируем самостоятельно. При их отсутствии привлекаем спасателей. Эвакуация проводится большей частью судов под российским флагом, а также иностранных государств. В рамках российско-норвежского проекта в 2020 году был оборудован кабинет неотложной помощи или так называемых острых больных в удаленном отделении нашей Ненецкой окружной больницы в сельской местности. Кабинет оснащен не только медицинским оборудованием, но и системой видеоконференц-связи с возможностью передавать в реальном времени показания с монитора пациента. Взаимодействие Ненецкой окружной больницы с медицинскими подразделениями округа осуществляется круглосуточно через диспетчера отделения санитарной авиации посредством телефонной или телемедицинской связи. Важную роль при оказании медицинской помощи на территории НАО играет телемедицина. По результатам телемедицинской консультации около 10% случаев не требует вылетов санитарной авиации. Пациент наблюдается на месте или эвакуируется рейсовым бортом в Ненецкую окружную больницу. Статистика проведенных экстренных телеконсультаций представлена на слайде. Она имеет тенденцию к увеличению. Хочется отметить, что совсем недавно часть медицинских пунктов на месторождениях нефтегазовой отрасли была подключена к окружной системе телемедицины. Телемедицина дает возможность получить более полную информацию о пациенте, принять адекватное решение по установлению диагноза, дальнейшей тактики ведения больного и принять решение по необходимости его в эвакуации. Это также является большой моральной и практической поддержкой для медицинских работников в удаленных населенных пунктах, где очень часто один на один с пациентом остается врач или фельдшер в условиях ограниченной диагностической базы. COVID-19 принес свои положительные моменты в плане развития телемедицины на территории нашего Ненецкого округа. В нашем округе один раз в 2 года проводится международная конференция, так называемая арктическая медицина, телемедицина. В 2022 году у нас будет очередное проведение данного мероприятия. Мы всех приглашаем участие принять в данной конференции. Да, следите, пожалуйста, за информацией. У меня все. Спасибо за внимание.
Thank you very much, Mr. Barnevin, for this very interesting presentation of emergency preparedness and innovations. And also thank you to the invitation to the conference later. Now we continue with the last speaker today, Mr. Mohammed Al-Harani, Head of Department at the Arctic University of Norway, who will speak on the future of higher education and international health collaboration after COVID-19. Please, Mohammed, the floor is yours.
Can you hear me now?
Yes, we hear you clearly. Please go ahead.
Thank you for the invitation. I have been given the opportunity to give a short presentation about the future of higher education and international health cooperation after COVID-19 pandemic. My name is Mohammed Al-Harani, and I am the head of the Department of Clinical Dentistry at UIT, the Arctic University of Norway. I guess all of you know this famous picture that have taken the world by surprise in March 2020. And all of us, we moved from fully occupied campus with the student to this scenario, where all the lecture halls are empty, the clinics are empty. That was, the world has been taken by surprise in that time. And shortly after that, all of us are familiar with this scenario where shortly after the pandemic struck the world, that we went into a virtual classes, online education. And COVID-19 came also when we have also 2 projects with our colleague in Russia. We have 2 projects with them, Norwegian Russian network in antimicrobial stewardship in dental practice in the circumpolar region. And this is in collaboration with Northern State Medical University. And also with the same university, we have another project, which is oral diseases in the circumpolar region, approaches for treatment in Norway and Russia. And we were starting to worry at that time, what will happen with those projects because of COVID-19 pandemic. And in order to understand the situation, let's just talk a little bit about what are the driving forces in higher education. We know that society and the public needs are one of the main forces that drive higher education. We know also that the value of university degree is one of the driving forces in higher education, although nowadays we hear about strange stories where high-tech companies, they hire people without the need for university degree. But generally, university degree is one of the main forces that drive higher education. We have also diversification of institutions and study program that has been also a driving force, and the pursuit of lifelong learning. This is another driving force. And it seems now that pandemics, they are additional driving forces in higher education. So the COVID-19 pandemic, of course, it was a disruptive force to higher education and international cooperation at the beginning, but it also accelerates the change and transformation of higher education and international cooperation. And COVID-19 pandemic, it actually came in a time where higher education in general is stagnant to real transformation. And I will explain a little bit what we mean by that. And if you look at the societies today, technology has transformed the way we learn, the way we interact with each other, the way we look into things in the societies. But implementation of technology in higher education is still not optimal. And there is an increased pressure for institutions in higher education to effectively leverage new technologies and integrate them into their teaching curriculum. This is in order to deliver a better outcome for the society and also better skills for the employability for their student. This is very important to understand. And if we look at how the digital technologies has disrupted higher education and influenced higher education, in 1992, there was the introduction of emails, and emails today as a crucial part in any educational institute. We have in 2000 to 2003 open online courses, and that was started in MIT in the United States. And at that time, it was basically making PDF file available online. And the conclusion was that delivering the same quality using online courses is not easy. In 2004, 2005, the introduction of Skype, smartphone, Wi-Fi, e-books, digital libraries, and 2012, it was the year of MOOCs. And we know that MOOCs, this stands for the Massive Open Online Courses. And there are several platforms that provide those MOOCs. We are talking about Coursera, for example, edX, FutureLearn, and so on. So many platforms that can produce those MOOCs courses. But the conclusion also was that broader implementation and acceptance of those courses is questionable. And those courses mostly would be applied for lifelong learning, but they cannot substitute the traditional classroom education that is happening in the universities. So digital technologies has helped higher education institute to ameliorate the disruption caused by COVID-19 pandemic. Of course, we hear more and more about virtual classes. Digital lecturing platforms are being used to ameliorate the pandemic challenges, Zoom, Teams, Skypes, and etc. And we are hearing more and more about e-lecture, webinars, e-seminars, digital lecture. And there is still much work ahead in order to use digital technologies to transform higher education and global cooperation. And when I talk about transformation, we should also think about change. What we need in the future is transformation and not basically change to a certain disruptive force. The differences between change and transformation, if we are talking about change, we are just fixing a problem, but in transformation, we are creating the future. Change, we just implement defined alternative, but here we have the opportunity to reinvent and discover if we are talking about transformation in higher education and international cooperation using digital technologies. Again, we have to think about new strategies, and we have to cut across discipline and organization in order to transform higher education and international cooperation. It seems that COVID-19 is the crisis universities needs to have. Basically, it's a crisis with opportunities that could come with it. And also COVID-19 pandemic offers universities a one in a generation opportunity to put their dysfunctional strategies behind them. And it is going to be more and more use of digital technologies in higher education and international cooperation, both at the national and transnational arena. And those technologies will help to provide education on demand, and they are going to help make the education more relevant and also personalized. Up to today, we are approaching our student as a one type of mind, although we know individuals, they have different ability to learn. And now it's becoming more and more obvious that we can use digital technologies to make our education more personalized to fit individual students. And it will be using technologies will help us to make our education in higher institution more adaptive to any disruptive force in the future. And it will be lifelong learning using those digital technologies. And in order to integrate those digital technologies for international education and international cooperations, we are going to talk about more in the future about artificial intelligence. We are going to talk more about advanced analytics. And we are going to use more and more augmented and virtual reality, both in education and both in international cooperation. We are also seeing the emergence of wearable technology that students can use in order to have a better and active learning in the universities. And also we are also seeing more about algorithm mentors, softwares that can advise students how to learn based on their circumstances. Future cooperation in health. Nowadays, we have approximately 50 million medical students worldwide, and this number is estimated to increase to about 130 million students by 2030. And in order to meet the challenge of educating those 130 million students by 2030, then online core medical education can be done at scale in collaboration with many universities. And we are going to see more collaboration effort between universities in the global north and the global south. And we are going to use technologies to advance technological advancement to enable learners from all the globe to gain advanced skills. So in the future, collection of data from multiple locations using digital technologies and integrate those data into educational portfolios will be a way forward. We will see an expansion of joint degree based on online modules. Of course, those are existing today, but nowadays we are talking about more and more expansion of those joint degrees, and not only that, but also a full degree that is based on online modules. And many universities have started to do that. We have now universities that provide master in international health, the whole master based on online models, top universities. And we will see more and more global consultations. We will see more and more diagnostic support between several universities, between several people from different aspects of the globe. So it seems that COVID-19 pandemic, it was the crisis that we need in order to think how we cooperate, how we educate our students in a better and effective way in the future using those technologies. Thank you very much.
Thank you very much, Mr. Al-Harani, for this very interesting perspective on the future of higher education and health collaboration. We have now come to the end of session 1, and I will try to make a little summary of these 2 hours. First, I would like to thank all of you for your presentation, interesting and well performed. And I must say I'm impressed by all the important work that is going on and the fruitful health cooperation we can see in the Barents, and even if the pandemic has posed challenges, of course, for our cooperation. When it comes to the first opening session, I had some technical problems I apologize for, but I can see from the preparations we made, I understand that Mr. Wilén focused on that the Covid-19 and new variants will require a continued cooperation in the existing Barents structures to best share best practices for preparedness and how to better find early regional situation awareness. Also to continue the important work of climate change. We then had a presentation from the Secretariat facilitating cooperation post-COVID-19, and Mr. Carlson highlighted some initiatives in this area, and digital meeting in the future will be more prominent, he said, but physical meetings are, of course, also very important. Some words from the part in our session dealing with HIV and TB program. We were informed about very interesting findings from a survey with a strong impact on Barents HIV and TB services in our region. And we learned that there is an absolute willingness and interest to cooperate across the region, and the network is still strong, even if some stagnation can be observed, if I understood correctly. But different forms of cooperation will be discussed for the future. And we were also informed how the pandemic has influenced the current projects of tuberculosis in the northwest Russia. On the third part of our session, there was presentations on the program on children and youth at risk. And we were informed of a very interesting study currently carried out on children's physical health in the Barents to understand the current situation we have now regarding regarding children's physical health and what can be learned and shared between regions. There will also be a concrete toolbox how to increase children's physical health. We were also reminded in this part of the session that all children are vulnerable during a pandemic, but some children are more vulnerable in a time of crisis. And we need to know more about the long-term consequences from crisis. I also had a presentation from the Youth Council, informed from a successful youth conference with a lot of positive feedback. Happy to hear that. And there is a recording from this conference that is available for more information. We were also informed about the ongoing work in this council to make it stronger, and also some very interesting upcoming events in regard to the Youth Council. Finally, we had some information, very good presentations regarding new technology and methods. And we heard that strategies are needed now to build on the current momentum of a greater use of digital health, and also learn from experiences from digital health used now and developed during the pandemic. Strong leadership are needed from government and national health bodies. Important to support design and use of digital health tools at local level. We also had a very interesting presentation from the NENETS on air emergency preparedness and innovations in emergency medical assistance in the Arctic, where we can see an increase in flights and evacuated persons, and also telemedicine at consultations has increased. And we were also invited to a conference on this topic by the Netherlands region. Lastly, we also heard that there is an increased pressure in higher education to use technologies and integrate them into the teaching, and that future collaboration in education and health will see a broad expansion of this. Yeah, there were much more said, of course, that this was a little summary for you. Before we close this first session, I just want to say that I'm sure that lessons learned from the pandemic will help us to further strengthen and revitalize our cooperation. The vulnerabilities of healthcare systems have been revealed by the pandemic, and an even closer cooperation for the future will be important. So thank you very much for joining us this morning, and don't forget to connect again at 2 o'clock when we continue this conference with a political session. So thank you very much for your attention.
Oslo and Umeå to the second session of this meeting, where we will discuss health cooperation in the Barents region after COVID-19. This is the third meeting on health under the Norwegian chairmanship. Norway and Västerbotten are pleased to have such a solid program with many experts, and we have enjoyed the presentations in the first session. Now we will move to the political perspectives. It is a pleasure for me to first introduce Audun Halvorsen, State Secretary from the Norwegian Ministry of Foreign Affairs, on behalf of the Norwegian BEAC chairmanship. Please, State Secretary, the floor is yours.
Thank you, Gøril. Excellencies, colleagues, ladies and gentlemen, and friends of the Barents region. It is a great pleasure to welcome my State Secretary colleagues and all of you to this Barents Health Ministers meeting. One of the priorities from the outset of Norway's chairmanship of the Barents Euro-Arctic Council has been to promote health issues on the Council's agenda. We organized the first Barents Health Ministerial meeting in November 2019, and then the pandemic outbreak in March of last year made the importance of international cooperation on health clear to the world at large. In December 2020, we brought together experts online to discuss digital tools for better healthcare. It was very inspiring to listen to the insights of doctors, researchers, and young entrepreneurs. COVID-19 has led us to seek new digital solutions, and e-health and new technology will be an important part of future health policies in the Barents region. During the pandemic, naturally, Norway conducted most of its chairmanship activities online. However, we remain committed to further promoting Barents cooperation together with Västerbotten, the Chair of the Regional Council, and our other partners. And let me take this opportunity to thank the member countries and the regions, the International Barents Secretariat, the Joint Working Group on Health and Social Issues, and all the other Barents working groups. Your unceasing efforts are helping to build a stronger, more resilient Barents region. We are convinced that the Barents financial mechanism, which we hope will be approved at the Barents ministerial meeting on October 26th, will strengthen the activities of the working groups. There is no question that COVID-19 has had serious consequences for the people living in the Barents region. The Indigenous Peoples Summit on 8th of June showed the many impacts of the pandemic on Indigenous populations. And at the Barents Youth Conference on the 1st of September, we heard about the many young people who are struggling with mental health challenges as a result of these difficult times. The remote location of many communities in the Barents region makes them highly vulnerable, and this has been underscored by the closing of borders due to the pandemic, which makes it all the more important to address health in the Barents region at the political level. I think the presentations throughout the day has underscored the importance of this topic, and I look forward to the political interventions. The Norwegian chairmanship also gives priority to knowledge. The Barents Cooperation is about supporting and learning from each other. And although we are still dealing with the pandemic, we can finally start discussing our post-COVID-19 health cooperation, and I believe that we all agree that no country can provide all the health solutions on its own. In the true spirit of Barents collaboration, we must work together and share our knowledge and experience. And this conference, this seminar today, is an excellent example of that. Thank you very much.
Thank you, State Secretary Halvorsen. As you know, Norway and Västerbotten enjoy close cooperation between the two chairmanships. It's now a pleasure for me to introduce the co-host of today's session, Governor Helene Hellmark Knutsson. Please, Governor, over to you.
It is a pleasure for me to be here with you today. My name is Helene Hellmark Knutsson, and I'm the Governor of Västerbotten and the Chair of the Barents Regional Council. When we had our last Barents Health Ministers meeting in November 2019, it was just 1 month before the COVID-19 virus was detected and changed everything. No one could foresee the development that we were facing, and almost the entire chairmanships for Västerbotten and for Norway have run entirely digital because of this. We are not only staying in our countries and hometowns due to the different restrictions, but many of us are also staying isolated in our actual homes to prevent spread of the infection. The COVID-19 situation has truly affected every aspect of our lives, and it is still teaching us new ways to communicate, live, and take care of our own health. Even though we have, as you all know, 20 successful years of health cooperation in Barents, this pandemic has given us and the whole healthcare a little push forward. Not at least in the field of digital healthcare and e-health. That is important for our rural areas and has also been discussed at the e-health seminar in December last year. Today, the health service works more with emergency digital visits, follow-up and self-monitoring of the chronically ill at home. The latter means that the patient follow-up tests are valued with the support of digital technology from their home. The pandemic has also paved the way for new vaccines and medicines that could be valuable in the future. For instance, the new mRNA vaccine technology will be able to be used against other viruses like HIV. So even though we cannot meet in person right now, the Barents Cooperation and all its workings areas are staying strong. Much of this has to do with a stable foundation that has emerged throughout the years and that we now can continue to build upon. And with these words, I welcome you to today's high-level meeting on Barents Health Cooperation after COVID-19. Thank you.
Thank you very much, Governor Helmark Knutsson. We will now hear from the State Secretary. It's a pleasure for me to give the floor on behalf of the Norwegian chairmanship to State Secretary Maria Bjerke from the Norwegian Ministry of Health and Care Services. Please, State Secretary Bjerke, over to you.
Dear colleagues and Barents friends, the COVID-19 pandemic has hit the health sector hard. We have been faced by the risk of being infected and with the consequences of the pandemic on our daily life. All at the same time, it has been our task to tackle the pandemic itself. Under these conditions, it is impressive that we have managed to keep the Barents Health collaborations going strong and even strengthened some of our collaboration initiatives. The digital seminar on e-health in December last year demonstrated this. So what have we learned? The pandemic has been a real eye-opener for many on just how important health is and how it affects all aspects of life. I hope that we can make the most of this momentum. We need to prioritize health care and emergency preparedness in the years to come. The pandemic has also clearly demonstrated that we need networks and structures for international and regional health collaboration now more than ever. This applies to the Barents regions as well. We have a lot of advantages in our health collaboration. Firstly, the two-level structure with the national and regional levels working together. The Joint Working Group on Health and Social Issues is, as the name indicates, a joint working group reporting both to the Barents Euro-Arctic Council and the Barents Regional Council. The strong cross-border networks are important when it comes to infectious diseases and emergency situations. When developing strategies to prevent and control non-communicable diseases, we also benefit from the national-regional dynamic. The Know Your Heart study, a collaboration including Tromsø and Arkhangelsk, is a good example. Secondly, the set of agreements or developed together in the joint working group are very useful. They are not legally binding documents, but they point out the direction of the Barents Health collaboration. The programs help us determine what are the important common interests and how we should prioritize our efforts. Development of the programs are a joint effort by all the countries and regions, led by the joint working group chair and the co-chair. The 6th Barents Framework Program in Health and Related Social Issues was approved by the first Barents Health Ministers meeting in Oslo in 2019. I believe that the Barents Framework Programs, together with the specialist programs on HIV and tuberculosis, on children and youth at risk, on new technology and method for healthcare in sparsely populated areas, are important success factors. We have found a good way to formalize our collaboration and at the same time give room for initiatives from countries or regions. To conclude, making health a main priority of the chairmanship for 2020 and 2021 could not have come more timely. I would like to thank you for the excellent cooperation. I would also like to thank my colleagues in the Barents countries and the regional representatives, as well as the regional chairmanship. I wish you all the best for the Barents Health Cooperation during the remaining time of the pandemic and also after COVID-19. Thank you.
Thank you very much, State Secretary Bjerke. It's really true what you said, that the two levels, the national and regional level, is the success formula of the Barents Cooperation. It is now a great pleasure for me to introduce the incoming chairmanship of the Barents Euro-Arctic Council, Finland. State Secretary of the Ministry of Social Affairs and Health of Finland, Eila Mäkipää. Please, we look forward to hearing your remarks.
Thank you. Dear friends, first I want to thank the chairs, Norway and Västerbotten, as well as the Joint Working Group on Health and Social Issues for the invitation. The chairmanships also deserve a special recognition for leading the cooperation creditably during these challenging times. Norway's chairmanship became the first virtual presidency in the Barents Cooperation and set an example for our future actions. As the upcoming chair, together with the Nenets region, Finland expresses its gratitude for the good work of the predecessors. Although the coronavirus pandemic has heavily stressed healthcare unit staff fatigue, work to combat communicable diseases, especially the coronavirus, must continue. It's even more likely that the COVID-19 has come to stay and new variants are developing. It will require a joint effort from all the countries of the world, including us cooperating in the Barents region. For example, to alleviate vaccine resistance through knowledge and means of influencing. Achieving high vaccine coverage, especially for those who are at risk, but also socially active young people and young adults, should be a common goal. Ensuring high vaccine coverage for other preventable infectious diseases is equally important now and in the future. The coronavirus pandemic has also deeply affected the inhabitants of our northern region, and especially of children and young people and elderly citizens. Social relationships during the pandemic has been constrained, grandchildren and grandparents deprived from their company, and in worst case, it has had an impact on their well-being and mental health. In the future, practices must be found to maintain these contacts that are even more important in the sparsely populated areas of Barents. In the post-pandemic period, there is also an evident need to evaluate the actions where cross-border cooperation would also work better in the future, and where restrictions to people's movement would be minimal. We need to use the existing Barents structures to share best practices for pandemic preparedness and to get better early regional situation awareness for our future actions. There are plenty of people having dual nationalities living in our areas, and they and many other people in the region work across the border. This must be better taken into account in contingency plans so that no one is harmed, and on the other hand, the measures required to combat the epidemic are implemented effectively. The pandemic has also taught us to use remote technology in an agile way. In sparsely populated areas, it's hoped that such solutions will remain permanent for other activities. Telemedicine that has been one of the Norwegian priorities will remain one of the priorities also in the Finnish Barents presidency. Although recovery from a pandemic will take a lot of time and focus, attention still needs to be paid to the control of chronic diseases, especially infectious diseases. The fight against tuberculosis, and in particular multi-drug resistant pathogens, is a common challenge, even taking into account in cross-border transactions. Many long-term illnesses have received less attention due to the pandemic, and the fight against the population-level damage they cause must also be continued. Aging and the lack of broadband solutions also challenge healthcare and how new technologies can be introduced. Inevitably, climate change is also will also have a significant impact on the industry and livelihoods of the people of the Arctic, as well as on their well-being and the emergence of various new diseases and the intensification of symptoms. Examples of this are the increase in smoke pollution caused by drought-related forest fires, the increase in pollen levels, the comorbidities of extreme weather events, and various other diseases transmitted by new vectors, and so on. Finland will seek to bring together authorities, researchers, and NGOs to find ways both to reduce greenhouse gas and black carbon emissions originating from outside the Barents region, and to adapt to climate change without harming nature or hindering traditional land use. The action plan on climate change for the Barents region will be accepted on October 26th at the Tromsø Foreign Ministers meeting, which will end the Norwegian chairmanship. Promotion of the action plan and the work relating to Barents environmental hotspots in Northwest Russia continue to be Finland's priorities. When taking up the baton, Finland continues the good efforts of the previous chairs and aims to enhance synergies with other operators in the Nordic region, such as the Northern Dimension and the Arctic Council, along with the regional actors. Thank you.
State Secretary Mäkipää, we really look forward to Finland's chairmanship of the Euro-Arctic Council, and let me take the opportunity to thank Finland for your solid work on the updating on the Barents Action Plan on climate change. It is now a great pleasure for me to introduce Deputy Minister of Health of the Russian Federation, Mr. Oleg Salagai. Please, Deputy Minister Salagai, the floor is now yours.
Thank you very much, Chair. On behalf of the Ministry of Health of the Russian Federation and on my own behalf, let me first and foremost welcome all the participants of the Barents Regional Conference dedicated to cooperation in the field of healthcare after COVID-19 pandemic. Let me take as well this opportunity to express our gratitude to organizers of today's event and extend my gratitude to Norwegian presidency in the Barents region. The annual meetings within the Barents Euro-Arctic Council have proven to be an effective platform for discussing regional health problems. Today, we are in the midst of a pandemic and the ongoing spread of the new coronavirus infection. In this regard, the fundamental task for healthcare system remain the organization of preventive measures and the provision of adequate care to patients with the coronavirus infection. Undoubtedly, vaccination is the primary defense against coronavirus. Russian scientists were the first to develop a vaccine against coronavirus, which has shown its effectiveness and safety. Today, we have 4 vaccine products created on various platforms. Sputnik V flagship vaccine has been registered and is being successfully used in more than 70 countries. At the same time, the accumulated data on the coronavirus suggests the emergence of a wide range of health consequences of this infection, which require early detection and treatment. Since July 2021, health screening has been provided free of charge for people who have had a new coronavirus infection. To date, more than 250,000 people have undergone such screening. We are also restarting all types of preventing screenings provided for citizens of the Russian Federation. This year, more than 25 million people have taken the opportunity to pass them. A year after the start of the pandemic, it became clear that up to 70% of those who had a coronavirus infection needed medical rehabilitation. For these reasons, the Ministry of Health is preparing a federal project within the framework of which the re-equipment of departments and centers of medical rehabilitation in the regions will be carried out. It will lead to increase the availability of medical rehabilitation for those who are in need of it. Prevention and treatment of NCD not only did not lose their relevance during the pandemic, but even became more significant. The high burden of NCD creates conditions for a poor prognosis and course of new coronavirus infection. Reducing the burden of NCDs is one of the major health policy priorities in the Russian Federation. The key to tackling NCD is prevention of risk factors. In our country, the federal project Strengthening Public Health, approved by the government of the Russian Federation, is being implemented. This project provides for systematic actions to form a public health ecosystem, including strengthening infrastructure, developing and implementing regional and municipal programs involving the corporate sector, non-profit organizations, urban planning, and communication campaigns. Improving mental health is also an important challenge. Systematic work in this area has made it possible to achieve tangible results. Over the past decade, alcohol consumption has dropped from 15 liters to about 9.1 liters per person, and smoking prevalence has dropped from almost 40% to 21%. The results of this work were noted by the WHO and United Nations Interagency Task Force on NCD. I am confident that these areas have serious potential in terms of cooperation and joint search for solutions to the most significant regional problems. In conclusion, let me thank all the participants in today's event for interesting and informative speeches and wish us a fruitful discussion. Thank you.
Thank you very much, Deputy Minister Salagai, for your insightful input. You are right that we have a lot of areas where we can cooperate for the best of the countries in the region. Dear friends, this meeting is organized in close cooperation with the Joint Working Group on Health and Related Social Issues. Sweden is the chair of the working group on the national level. I am pleased to now give the floor to State Secretary from the Ministry of Health and Social Affairs of Sweden, Maja Fjestad. State Secretary, welcome. We look forward to hearing your remarks.
Thank you so much. Thank you for the invitation. I'm so glad to be here. And also best regards to all my colleagues out there. I know you have been working day and night with the national response to the COVID-19 pandemic. And I hope next time we meet over lunch and compare notes on this very special time. So dear colleagues and friends of the Barents, let me say something about the Barents Cooperation first. The Barents Cooperation, of course, is a cornerstone of regional cooperation and is a high priority for Sweden. It has become a model for successful regional cooperation, symbolized by the close interaction between 13 different national actors. It is a proven track record, I think, of important practical achievements in key areas of cooperation to the benefit of the region and its people. The pandemic has also shown that health is the foundation of a functioning and wealthy society. It has also shown how vulnerable and interlinked our societies are. We face the same common interests and challenges, making dialogue and cross-border cooperation even more necessary. Lessons learned from the pandemic will help us to further strengthen and revitalize our cooperation and seek synergies with other regional organizations in the northern part of the world. We should work together to strengthen our respective regions' preparedness for future health risks. The vulnerabilities of healthcare systems have been revealed by the pandemic, and even closer cooperation for the future will be important. The unequal public health has also been put in spotlight during the pandemic. The pandemic has hit the already vulnerable groups the worst. And I think it's fair to say that equality is an important part of a healthy society. The sparsely populated Barents regions face specific challenges providing high quality and comprehensive healthcare services. To plan for, organize, and deliver healthcare in sparsely populated areas pose severe challenges. During the pandemic, we have experienced how important it is, especially in sparsely populated areas, to make mobility over national borders possible for essential staff, for healthcare workers and other healthcare professionals. Cross-border travel restrictions have hampered this possibility. Following the pandemic, the use of digital tools has increased tremendously, making healthcare more and more accessible. The need for remote digital healthcare solutions will likely increase in the future and can improve access to healthcare for the Barents population and contribute to more equitable and gender-equal health. The digital transformation of our health systems is of highest importance and relevance for the current and future challenges we face in the Barents region. We must cooperate to take advantage of the new technologies made possible through digitalization. Digitalization must always be done for and by patients and professionals and never for its own sake. Since the foundation of the Barents Joint Working Group on Health and Social Issues in 2002, the health collaboration has steadily increased in significance and is now regarded as a vital part of the Barents population, and its work is of highest importance and relevance for the Barents region. The working group, currently chaired by the Russian Republic of Karelia and Sweden, gives priority to technologies and methods in healthcare and to develop and stimulate regional initiatives for improved healthcare systems. It also underlines the importance of prevention of and combat against HIV and tuberculosis, and to promote the well-being of children and youth at risk. So, dear colleagues, dear friends of the Barents, I may say that we could see a new dawn of regional collaboration after the corona pandemic. And the Barents cooperation has been a cornerstone of regional cooperation for decades. I am convinced that our joint efforts will contribute to a sustainable future for the Barents region, as strengthening cross-border relations and mutual understanding. We look forward for future cooperation on healthcare services and good welfare, and I hope to see you physically next time. All the best from Sweden.
Thank you very much, State Secretary Fiesta. Please let me express gratitude on behalf of the whole Barents family to the joint chairmanship of Sweden and Karelia for your continuous efforts for health cooperation in the Barents region, especially in times when your days are so demanding. Like you said, you work day and night. Dear friends, Indigenous peoples is a key part of the Barents cooperation and a priority for both Norway and Västerbotten. I am pleased to introduce our next speaker, Piera-Heikka Muotka, Chair of the Working Group of Indigenous Peoples. Please, Piera Muotka, Boris, we welcome your remarks.
Borich Barents Verde, dear Barents friends. The pandemic has amplified existing vulnerabilities in our societies, whether it be existing social structures or lack of infrastructure or poor connectivity. Indigenous peoples worldwide are particularly vulnerable regarding their health and well-being. This is also the case for the Barents region. Most indigenous societies are characterized by being remote and situated in sparsely populated areas with poor infrastructure and challenging weather conditions. Distances to healthcare facilities are key in this regard, and studies have shown a direct coherence between increased distance to hospitals and an increased risk of death. Patients with respiratory emergencies have been shown to have the greatest association between distance and mortality. The Barents countries should work together to ensure a hospital structure that covers all of the Barents areas, offering inhabitants a minimum distance to necessary healthcare services, regardless of the borders dividing us. These are the types of cross-border challenges that require the holistic problem-solving approach of the Barents cooperation. What do you do when as an Ennets or a Sami reindeer herder are faced with medical emergency out on the tundra while herding reindeers. If you are lucky, you might have phone reception. Access to the internet and ensuring connectivity in the whole Barents is therefore vital, even on remote tundras. These are vast areas actively used by humans and not a desolate wilderness. Connectivity in remote areas of the Barents region is not only important for the indigenous peoples, but also for the joint rescue missions conducted by the states. Along the main traffic lanes of Finnmark County, in 2021, you will still experience an unstable phone connection. Lastly, the rights of cross-border families and communities must be respected, even at times of crisis. Pandemic restrictions have brought tough border restrictions through traditional Sami territories. While traveling within nation states from areas of high infection rates in the south to the north has been allowed, families in low infection rate cross-border areas in the north have been denied access to their family members. At one point in this pandemic, Finnmark was closed off from the rest of the country because of challenging weather conditions along the coast. In a normal year, transit through Finland would have been possible. There were, of course, made some adjustments to the border regulation in these extreme cases, but it goes to show how vulnerable our societies are when the weather is at its worst. We understand the need for strict entry restriction to mitigate the effects of imported infection. But after 1.5 years, one would expect the Barents countries to have been able to develop more nuanced restriction, taking into account the needs of cross-border communities in low infection areas. Thank you.
Very much, Piera Muotka, for your insightful remarks. Youth is another topic high on the agenda of the chairmanships of Norway and Västerbotten. Now let me introduce the Deputy Head of the Barents Regional Youth Council, Martin Gamst Johnsen. Please, Martin, over to you.
Hello, Barents friends, colleagues. Good to see you all here today. My name is Martin Gamst Johnsen. I'm 23 years old, and I'm the Vice Chair of the Barents Regional Youth Council. I come from the county of Troms and Finnmark, and as I saw the list of speakers, I felt tremendously grateful to be given the opportunity to speak here today. I would like to take the opportunity to say that on behalf of every young person in the Barents region, to all the men and women who work in healthcare or surrounding healthcare, you truly are heroes every day in your efforts to help people. It is truly respectable and commendable. As for the challenges for young people, I can say this. Being a young representative during the pandemic has been challenging. As many of you know, the international cooperation projects has been stalled or put on hold or moved to a digital platform. It has been the same case for many of the projects surrounding the Barents Regional Youth Council. To represent young people effectively, you need to be able to talk to one another, which is a tremendous challenge when you are not able to travel and meet people. It is the essence of the Barents cooperation, the ability to meet, communicate, build relationships, and continue to build these relationships so we can change the future for the better. Of course, like all the branches of the Barents Cooperation Network, we have had to change and adapt to face these new challenges. But youth cooperation is unique in the way that we work only for what we call a youth generation model, where a youth generation might only be 2 to 3 years old. And at that time, and that is all the time you have. After all, we are not young forever. So our time is limited. As for myself, I have spent almost my entire term in the Barents Regional Youth Council during the pandemic. So I can say I might not know so much what it was like before, but I believe that we have been able to achieve a lot with the help of the Barents Regional Youth Council and the Barents Euro-Arctic Council. There is truly a genuine historical cultural change going on right now across the Barents region, where the voices of young people are being heard and we are being included. An example of this would be the high-level youth summit that will be held in Tromsø the 26th of October, where the event is made by and for young people. The event will be live streamed, and I hope as many of you will take the opportunity to listen in and learn about what truly engages young people. I also want to say that we are truly grateful for the platform that we have been given and the ability to communicate our beliefs and thoughts on matters that determine our own future. In this regard, I would like to say that in terms of young people's reaction to the pandemic, we have obviously had to adapt and change, and young people are used to online communication and technology, but I fear that many young people feel the burden of loneliness and the lack of social connection. Young people form social connections that define them and shape who they will become later in life. But it is not always easy to form those connections when everyone is a potential threat to you or your family. It is a tremendous psychological burden for a young person to take the decision to sacrifice your social life or being safe. It is a hard choice to make for a young person or a teenager. When speaking to young people, mental health is something that almost everyone mentions. I would like to encourage the leaders of the Barents region to make it a key to include young people in the debate about health. And when you include young people, you have to remember, you don't always have to agree to everything we say, but the important thing is that you truly listen. And of course, remember, young people are here to stay. So with that, I will say thank you for giving me this time and opportunity. Thank you.
Thank you very much, Martin, for your clever remarks and for this reminder. And we all look forward to the Barents Youth Summit, the 26th of October, where young representatives will speak directly with the ministers, and we encourage everyone to follow. Dear Barents friends, we have now reached the end of today's meeting. Mikael Bergström, in charge of Västerbotten chairmanship, we have heard so many interesting presentations. Do you feel optimistic about future health cooperation in the Barents region?
Thank you, Madam Chair. Yes, I feel optimistic about the future for the health cooperation in the Barents region. Since the foundation of the cooperation some 30 years ago, the health cooperation has steadily increased its significance and is now regarded as a vital part of the Barents cooperation. Health, that is a topic that both Västerbotten and Norway have been focusing on in our chairmanship program for the last 2 years. And as State Secretary Bjerke said, the pandemic has been a real eye-opener for many on just how important health is and how it affects all aspects of life. It also highlighted the importance of international cooperation on health. I feel optimistic about the future for health cooperation in the Barents region. As several of the speakers of today has touched upon, e-health is of particular interest to this region in reaching out to the communities in sparsely populated areas. Norway and Västerbotten and the joint working group on health and social issues organized an e-health seminar almost a year ago. And the working group has continued to work with the e-health ever since. And as we heard from State Secretary Mäkipää, the incoming Finnish presidency will continue to work with e-health and then securing the continuation of health cooperation on the Barents agenda. Thank you all for an interesting day, and now back to you, Görel.
Mikael, yes, I think we've really seen in today's intervention underlining of the political will to continue this cooperation. We will see you soon, the 26th of October, but before that we have 3 more events. It's a busy Barents Autumn Transport Ministerial meeting on the 14th of October, Knowledge Ministerial on the 18th of October, and the Forest Forum the 20th and 21st of October. So we will be busy and we will see you soon again. Thank you.